New at 4 in today's Community Focus, a new campaign aims to raise awareness about substance use among older adults. Joining me now to talk about that is Dr. Philip Chan with the Rhode Island Department of Health. Great to have you back.
Thank you for having me.
So I wanted to talk about this campaign. It's called No Matter Why You Use. What exactly is this campaign? What are you aiming to educate folks about?
So this is a campaign focused on older adults, age 45 age and older. We're actually seeing an increase in fatal overdoses in that group. So the goal of this campaign is to draw awareness with the goal of reversing these concerning trends.
And, you know, I think there's sort of this notion that substance use disorder is a younger person problem, but it sounds like that's not entirely true.
It is a younger person's problem, but it's also an older person's problem for very different reasons. So in older folks, we generally see multiple medications. Older adults may be less socially connected, be more isolated. And so a lot of times we see folks get addicted to these medications and not mean to.
And so what are some of the higher risk factors among older adults that put them at this elevated risk for potential overdose?
I would say really two things. The first is polypharmacy, meaning that a lot of older folks are on a lot of different medications. I feel like as a primary care doctor, half the time I'm just trying to cut down on medications that people are on. And the second thing is, I think for a lot of reasons, older adults are just more socially isolated and more likely to turn to things like substances and drugs.
And what types of substances are you seeing older adults abuse?
So we're still seeing opioids, so things like fentanyl, but we're also seeing stimulants, so things like cocaine and crack and crystal meth. And the thing is, you never know if you get these drugs on the street, even if they're not opioids, you're never sure exactly what's in them. And that's what can be deadly if you're getting some of these drugs contaminated with fentanyl.
And you mentioned that there's this increasing rate of overdoses among older adults. What are we seeing right now in terms of overdose rates in Rhode Island and fentanyl being in the supply?
Well, the good news is we've actually seen rates coming down. And so it's really been a combined effort, not just the Department of Health, but Governor's Overdose Task Force, EOHHS, BHGDH, community organizations. Really been a team effort, which is nice to see. Rates are coming down. We are seeing fentanyl coming down as well, but still more than 50% of overdoses are due to fentanyl. And
if someone at home is watching this and they think, you know, I know someone who needs help or I need help, what resources are available for folks?
Two things I would recommend. First is online resources. Prevent Overdose RI is a great resource and it has additional resources on there. Just checking in with your primary care doctor. And there's a lot of great other resources online if needed.
And again, this No Matter Why You Use campaign, what's your message to folks? What are you hoping they take away from this?
Just to be aware that this is a problem, to be aware if you have a problem, to check in with people, with friends and family. And if you see someone using and you think they have a problem, ask for help.
All right, Dr.